Right, so shall we go back to what we were discussing about the COVID inquiry, Tonya?
Yes, I mean, I don't... You know, I shake when we start discussing the COVID inquiry. I mean, when I speak to people like Nigel, who still think that lockdowns did anything apart from harm, it blows my mind. It blows my mind. You know, talking about intelligent people, you were just saying, Boris is intelligent, he got first in his classics degree, but whatever. It shows you that really intelligent people have become mind-numbingly stupid just to hold on to their politics and their ideas when we see that there is no way that lockdowns were good for us. They were so bad. I mean, we had... It's funny, because I was just watching a clip of Valens on the BBC 10 days before we locked down, talking about the fact that this is a virus, you know, we just need to protect those that are elderly.
Mild flu-like symptoms.
Mild flu-like symptoms. We need to, you know, get herd immunity in the young and just look after the old, and off we go. 10 days later, it was an about turn. What was that about? Why did that happen?
And
because what was happening in other countries, don't you think that's what it was? Me Too, because in Italy was locking down, other countries, so they panicked.
Yeah.
That's what I think happened.
Well, but how dare these intelligent people panic? How dare they?
What Patrick Vallance said yesterday was that the lockdown should have taken place a week earlier.
Oh, rubbish, Nigel, that would have made a blind bit of difference.
Which was the feeling at the time. And the French...
Feeling from the Chinese Communist Party.
Exactly.
Well, from the French, actually, because I mean, the French locked down a week earlier.
Because of the Chinese Communist Party?
Yes.
Well, I don't think because of that, because infections were then doubling every 3 days, and they're in
infections, and we know that the recording of these infections and everything was really skew-whiff. It made no difference. It wasn't people dying, and that was not true.
Yeah, but the point was the only interventions we had at that time were lockdown, social distancing, and masks. Masks, obviously, arguably, whether they did any good or good at all.
But let's be truthful. If we didn't have social media and we hadn't have gone for this phase, would we have even noticed? We've had bad flus before, and all that happened was that people...
Well, yes, we would.
Die of flu,
230,000 people...
No, that figure is not correct.
230,000 people had COVID on their death certificates.
Yes,
seven in
COVID.
10.
My mother-in-law, who died of cancer, they tried to put COVID on her death certificate.
But 7 in 10 of
we know there's lots of lies going on there.
Had it as an underlying cause, which means it was the main cause of death for the majority of those people.
I can give you the actual ONS statistics on that. As you know, Nigel Nelson, this is an area in which I have spent a huge amount of time being a complete girly swat. Only 0.4% of COVID deaths were listed as having COVID as their only code on their death certificate. The ONS own assessment is that in summer 2020, 16,000 excess deaths were non-COVID, 18 to 21,000 excess deaths were COVID. There's been hundreds of meta-analyses now that prove that the idiocy and the non-scientific logic behind locking people up means it must never happen again. This inquiry, what is so frustrating, is that they aren't even discussing whether lockdowns should ever have happened in the first place.
That's the main thing, is why aren't they asking Valance, was the response justified in the first place?
Well, I mean,
that's what we need to understand.
Chris Whitty, we know today, will be saying that we shouldn't have locked down anything like as soon as we did.
That's right.
At all.
I mean, the scientists didn't actually always agree with each other. They're a bit like economists or politicians.
They don't worried about the impact on our mental health, and especially on kids.
But everybody had a different kind of function there. So Chris Whitty's function was the overall health of the public.
Yeah.
So he was taking into account all those other things. You know, what will be the effect on, as Tonya mentions, cancer patients,
mental health,
and so on. Rishi Sunak was concerned about the economy.
Quite right.
Was not concerned about health. The health secretary was concerned about decent figures for him. I mean, it obviously just depends on where you are and what your responsibilities are. But
is it relevant that Patrick Vallance had £600,000 worth of shares in GlaxoSmithKline and then was put head of the vaccine task force?
I think it's irrelevant. Yeah.
Why aren't they asking him?
Well, they may well do.
They haven't.
Have you seen
at a future occasion?
It was raised, but they didn't challenge him as to whether it was appropriate.
It was taken as credibility. They're taking these positions when these contributors to this COVID inquiry are asked to set out who they are. They take a fact like, I was a shareholder in Glaxo. Oh, that's really nice. Thank you, Mr. Vallance, for that detail. Where is your follow-up question? Did that affect your decision to lock people up, to recommend lockdown, because the solution to lockdown was going to be a jab in your arm and you had a vested interest? Why aren't they asking those questions now?
We go back to actually the timeline that when we first locked down, there was no jab in the arm. We didn't know at that point how long it would take to develop a vaccine.
But let's be honest. We've known know what's happened and we're moving forward now. So if lockdowns were necessary, why is Sweden not a tomb? You know, why not just a graveyard where they didn't lock down? Why we need to go back to the reasons of why they locked down.
Well, that's the point
why
of the
did the
inquiry.
power go to the head? We know now things like rule of 6 were straight up nonsense.
Oh, yeah.
So they
complete nonsense, yes,
so they should be on trial.
And the tier system was nonsense.
They should be on trial for frightening the nation, the damage that they did psychologically to the nation, never mind about what the lockdowns did, but this fear-mongering, this excess fear, was that coffee worth it when you go out for a coffee? They should be on trial for that.
Well, but regardless whether they should be on trial, the point of the inquiry is so we don't make the same mistakes over again.
But they're not asking the right questions to stop that from happening.
Well, yeah, but if the question is over lockdown, there was nothing else in our armoury at the time to actually deal with it.
No, we didn't. But this didn't deal with it,
Lockdowns have been
Nigel.
going on since the Black Death
No, they
700
haven't.
years ago. During the Black Death, they did
Not
it.
of healthy...
Because people were dropping
During
dead.
the Black Death? Are we seriously saying that our health strategy should be based on something from medieval
But
England?
it shows how little things have developed. So we were still stuck with the same kind of mitigations they had in medieval times. They covered themselves up. They socially distanced. They didn't call
Nigel,
it those
during
things
that
then.
period,
They
people,
did.
but during that period, people were dropping down dead in the streets. That was not happening with COVID.
They were,
it was
they were
fear-mongering.
collecting the dead in wheelbarrows, if you remember.
Thank you.
During the
Just to be
Black
clear,
Death.
during the Black Death. During the Black Death. So during COVID, that wasn't happening. It was a fear-mongering group. It was completely wrong, and the questions are not being asked in order to make sure this never happens again.
We didn't know at that stage how serious it might be. Number 10 were doing things like working out where to put mass graves. They were thinking about could they hire ice rinks as morgues, because they didn't know.
On false modelling.
In those early days, nobody actually knew what we were facing.
So why were we making such a drastic decisions? Why were we putting things like we need mass morgues? Why?
But because we might have done.
No, we
Based
didn't.
on who? Based on what the Chinese Communist Party want to do to bring down the West? If you think about that,
based on a virus we didn't understand, we didn't know how serious it was. We knew people were dying. We didn't know how many. We had the Imperial College report that said
we are not actually going to take on Imperial College modelling. We are not. We are not. Because everything they say is completely wrong. It's fear-mongering modelling. Nigel, we had a pandemic response.
It's a warning of what might
had been doing for a decade. We looked at our pandemic response. This is what we'll do if we have a pandemic, and they tore it up and threw it out the window, and we are suffering the consequences because of that. The people that tore up our pandemic response that we had studied, we had brilliant minds studying, deciding how we do this, was thrown away. The people that decided to throw that away need to be on trial.
Would you put them on a criminal trial?
Yes,
I would.
Absolutely, I would.
They would say they were doing their job.
Yes, I think, and I think they were, and I'm not suggesting that mistakes weren't made. Mistakes were made not just by the politicians, but by the scientists too. Eat out to help out was completely mad.
But that wasn't so mad. Why was that mad?
Why was it mad?
Yeah.
OK, well, I mean, I did actually go out for an eat out to help out, but I had one meal because the whole thing was so uncomfortable.
But that's
it was quite clearly a disease spreader to sit in a restaurant with a load of other people when
it's an airborne virus. It was always going to spread. Whatever happened, nothing we did was going to change that.
That's why Eat Out to Help Out was actually ridiculous, to make people go outside and go and catch the disease.
Just forget about that. The first lockdown, you're picking on things because you know that you're wrong, Nigel. The real thing is that lockdowns were completely incorrect. They were not the way to deal with this particular virus, which didn't hurt the young. You don't lock down healthy people. You care for people that have a virus and you guard them, but you don't lock inside their homes healthy people that this is not going to harm. That was the mistake.
There are two fundamental issues, and once you understand those, we understand why it was an overreaction and why you didn't need to be frightened, sat with your family. And it kind of breaks my heart thinking about you going out for your burger to help the nation and then being frightened. You were never at any significant risk of dying from COVID-19, and neither were your family.
Well, I mean, I don't know. All I do know is...
Well, I do know.
And
I could have given you the figures then, and I can give you them now, because what was the average age of death?
I know the average age of death was elderly.
82.
What was it?
82.
It was 80-something.
83. It was higher than average life expectancy.
Yeah.
And so this was always predominantly a virus that was affecting the elderly.
It was, but it wasn't just old people who were being affected. And once again, I go back to, we did not know at that stage what it might do.
Nigel, but we did.
Look, we knew. Yeah. And the infection fatality rate, I mean, they were talking in the COVID inquiry about the fact that they thought the infection fatality rate was going to be 4%. That's where Neil Ferguson got his 500,000 are going to be dead in 6 months from the Imperial College who have a vested financial interest to come up with those sorts of figures. And it wasn't the infection fatality rate for the vast majority of people was less than 0.1%. So it was proven now, over 70, it was slightly more, potentially more lethal than flu at that time.
But you and Tonya seem to think that it's actually rather like flu or a bad cold or something like that.
It is.
And it wasn't for the people who ended up on ventilators.
And what killed them was...
Can I give you an example of that? People that don't have peanut allergies, OK, do not die of peanuts. So the whole point is that there were certain people, a small group of people, the very elderly, the morbidly obese. These are the people that we had to protect and need to be protected from COVID. But the rest of the population did not need to worry. We're not going to get rid of peanut butter because there's a few people who can't eat peanut butter because they're going to die from it.